At Jamachi, what we tend to do with the tummy tucks is customize them. You know, we don't just do a cookbook tummy tuck. Everybody gets the same incision. Everybody gets the same sort of step by step. We kind of look at what is really your deficit, or what is your problem, what are you unhappy about, and we try to address it. Tummy tuck is kind of the layperson's terminology for an abdominoplasty, and I think even these days we are a little more sophisticated and we really refer to it as an abdominal contouring procedure. And the reason we do that is that the traditional tummy tuck involved just taking off the excess skin from the lower part of the abdomen and tightening the abdominal wall muscles. Over the years, it sort of has evolved to where we now add and subtract other little things to make the outcome better. So for instance, we may add some liposuction to the sides, we may add some liposuction to the top, just below the breast, in order to get a better aesthetic final product. So even though we use the word tummy tuck, it's really a bunch of techniques that are adopted in order to make the abdominal wall flat and contoured again. So the two basic steps that are always in there are getting rid of the extra skin that's on the lower part that's hanging over the belt line, and tightening the abdominal wall muscles so that the abdomen becomes flat again. The ideal candidate for a tummy tuck has loosened abdominal wall muscles, so the abdomen is sort of bowed out, and they have extra skin, so they can pinch a roll of skin at the lower part of their abdomen, or even sometimes above the belly button. That's an ideal candidate because you have to address the excess skin and you have to address the muscles, the loosened muscles. Now, if you look at the pictures before, for patients who are good candidates for tummy tuck, when you look at the side view, you'll always see that there's an overhang. There's a skin overhang at the belt line. That is a key component when you're examining patients to determine whether they really are good candidates for a tummy tuck. If they have this overhang, then they really have no other option. If you did simple liposuction and remove the fat, that skin would hang over even more. So when you look at them from the side profile, you always see that overhang, and you also see a convexity of the abdominal wall. So the abdominal wall curves outwards, and that's a sign that the muscles, the rectus muscles, which we tighten during the abdominoplasty procedure, need to be addressed also. And then when you look at their after pictures, you can see that the overhang, the skin overhang, is gone. You can see that the bowing of the abdominal wall is gone. The abdominal wall is straight, or it can even be convex, depending on how aggressive the patient wants to be with the muscle plication. You get the reaction about 2 weeks after the procedure, when the pain is gone and the swelling is now down, and they look at their new abdominal wall, a lot of times really with disbelief. I mean, when you're distended and you see all that skin hanging over before surgery, it's hard to imagine that you can actually have a flat stomach. It usually takes about 2 weeks for you to hit the point where they're really ecstatic and they're just excited and they're eager to go out and show off their new body to the public.